Welcome to the show. This week we have a fabulous lineup of stories with information to help you empower your health.
That's right, Michelle. We are going to continue our series on weight loss with chiropractor Dr. Lyon. And later, I'll be making some delicious barbecue ribs.
I like how you said weight loss and ribs in the same sentence. Before we get to that, we're going to check out another amazing profile. I knew I had all these peculiarities before I knew that there was a name for it.
The particularities Angela is talking about relates to pain caused by Ehlers-Danlos syndrome, a connective tissue disorder caused by a defect in collagen.
Well, it's like a muscle spasm and arthritis. It's just a muscle that clamps on and won't turn off.
Over the years, Angela tried just about everything to treat that pain, which is concentrated in her lower back.
You know, when something hurts and you try sort of usual things, and after a while, you get progressively sillier, right? As you run out of things to try.
Angela eventually experienced some relief thanks to prolotherapy. Ever hopeful, she thought she'd try something even more unconventional in the pain relief department: hypnotherapy.
Hypnosis is very good at modifying behavior and modifying belief. If you absolutely believe that sitting in that dentist chair is going to be a painful experience, then there is a very good chance that even if there's no pain at all, you're going to become highly anxious and effectively feel pain.
They don't put you to sleep or anything like that. I realized afterwards what they were doing was really helping me to focus on what I wanted.
By using hypnosis and by changing the belief that it's going to have, changing the behavior to one that says, okay, I can do this, we can do it. So we can't reroute the pain or anything like that. But what we can do is reduce the effect of the stimulus.
Hypnosis is often recommended by doctors for pain management, but some say it's more useful for treating stress associated with pain than the pain itself.
Well, it didn't go away. It's not going to go away, but I can minimize it to the degree that I can. And actually, the prolotherapy really helped more than anything else. But I might not have gotten that same benefit out of that if I hadn't had the relaxation stuff to go along with it. And it turned out to be a really good idea. I was very happy with the results.
Coming up on Empowered Health.
Are eggs really the cigarettes of the food world? Or are they your key to a healthy, happy brain?
You're watching Empowered Health. Eggs get a bad rap for being high in cholesterol and fat, but should we really be avoiding them?
Oh, Michelle, don't fear. Randy is here to unscramble that topic. Let's get cracking.
Oh.
How exactly did eggs become a controversial food? Are eggs really the cigarettes of the food world? Or are they your key to a healthy, happy brain? Eggs are a great source of tryptophan, an amino acid and a precursor to neurotransmitters like dopamine and serotonin, which are closely related to mood, sleep, and feelings of pleasure. Eggs are also loaded with choline. Health Canada has declared choline an essential nutrient, and research shows choline plays a role in brain function and neonatal brain development. Choline is also found in liver, cod, wheat germ, and ancient grains such as quinoa and amaranth. But eggs are one of the best ways to get choline in your diet without loading up on calories. You'd have to eat 13 times as much calories in peanuts, for instance, to get the same amount of choline as in one egg. What about that whole eggs are as bad as cigarettes study? The academic community was pretty quick to stomp all over that finding, but not before the media blared its ridiculous conclusions all over the planet. It's true that consuming egg yolks is correlated with the formation of carotid plaques in people with cardiovascular disease, but correlation is not the same as causation. People who are already ill may also be overweight, sedentary, and they may well be taking powerful medications. Eggs have long suffered from questionable dietary advice because they contain cholesterol, which, by the way, your liver produces all day long. And if you don't eat cholesterol, your liver simply produces more. The brain, remember the brain, is the most cholesterol-rich organ in your body. Cholesterol appears to pretty much run the show in the brain. Now, the cholesterol in eggs doesn't have a big influence on the cholesterol in your blood, which is associated with heart disease. A lot of people still try to reduce their cholesterol by cutting out eggs altogether, but the research doesn't really support that strategy. If your goal is lower blood cholesterol, you'll be better off adding whole grains, nuts, and healthy oils to your diet. Plus, the Harvard School of Public Health says that the nutrients in eggs may actually reduce your risk of heart disease. So enjoy your morning egg. It might just be food for thought. I'm Randy Shore for Empowered Health.
Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Because you have a spine, it's important to understand what chiropractic care means to your health. Your health always starts with a regulatory college. In this case, the College of Chiropractors of BC serves to ensure you receive the appropriate diagnosis and care from a qualified chiropractic doctor, today and tomorrow. That's also why BC's chiropractors fund research and education. Today, I want to introduce you to Dr. Michael Lyon, who is doing some important work in the area of weight loss.
In today's world, of course, a lot of people are seriously affected by health problems related to their weight. But it isn't as simple as just saying to people, take this diet sheet home or, just eat less, exercise more. It's easy to say, but it never works. So it's something that is a lot more complicated than that when you're dealing with people that have serious issues related to their weight.
If you have a weight problem, Dr. Lyon says that the issue is not weight loss, but weight maintenance.
People use willpower to lose weight. You find some special diet, you use willpower and you stick it out. But willpower is very much like a muscle. And you can only work a muscle so long before it gets tired.
It not only gets tired, but because of the effect on your metabolism, you're also at risk for gaining back more weight than you lost. That's why he's been working on supplements to help address the root of the weight problem. That is, food intake.
We've been working with a type of a dietary supplement. It's a highly viscous or sort of a thick water-soluble fiber that is something that you take before your meals or with your meals, and then you make a concerted effort to try to eat less food.
In today's world, we are sold extreme diet and exercise regimes. But with most other diet supplements, like green tea and vitamin B12 injections, there's not a lot of evidence to support their efficacy.
Some of the other B vitamins, like thiamine and riboflavin and so on, niacin, these have some integral role to play in the metabolic process, but whether giving you mega doses will drive metabolism up or not is pretty questionable.
Maintaining a healthy weight is critical in reducing inflammation that can lead to osteoarthritis, heart disease, diabetes, to name a few conditions.
When you gain 10 pounds, you've actually added 40 pounds of excessive stress to each knee. And so you can look at all of the joints, the vertebral joints, the so-called facet joints, the discs of the spine. All of these joints are bearing tremendous pressures when a person gains a lot of weight.
As you can see, it's not just about what we can do for you today. We're working to build a better tomorrow with better health outcomes for you. The College of Chiropractors of BC sets the standards for safety, outcomes, and your informed consent.
Hey guys, my name is Simona Marian and this is Jamison Ulf. Today we are going to show you how to perform and progress the inverted shoulder press for your simple fitness tips.
All right, Simona, so I'm going to get you to start the inverted shoulder press. Start with your hands in front of you about shoulder width or wider apart. Good. Next, you're going to lift your knees up and go onto your toes. Now, if your toes are closer together, you'll hit more of the core. Now walk up your feet closer to your hands. Right there, that's perfect. Engage your core, tuck your chin a little bit, and now slowly lower yourself to the ground till your forehead's almost touching. And exhale for a count of 2. Nice job. Go back down and exhale. Awesome. Now when you're ready to increase the intensity on this, you can elevate the feet further using a stool or a bench. Great. Good job, Simona. Try this exercise out and we'll see you next episode.
after the break.
I never talked about it a lot, but the one thing that bothered me more than anything else was the fact that my front teeth, the thing that most people were able to see when you smile, weren't the way that I liked.
Welcome back to Empowered Health. Now it's time to brush up on dental health.
Oh, the puns, VJ.
The fun.
Yeah. Then we're going to walk through the remarkable story of patient Kevin Dull, who didn't think he was a candidate for laser eye surgery.
In a previous segment, we discussed the benefits of replacing teeth with permanent dental implants. Today, we will meet another one of our patients that has undergone this treatment. Dave Tomlinson is known best as the color voice of the Vancouver Canucks on the Team 1040. After a career in hockey that spanned more than 14 years and 2 continents, Dave found himself missing 2 front teeth.
Well, what happened is I had taken a high stick to my front teeth and it took out both of my teeth, the whole tooth. And what happened was it also took a lot of the bone in my upper palate away as well.
He had these replaced in Germany many years ago with dental implants. However, Dave had recurring problems with his replacement teeth.
I never talked about it a lot, but the one thing that bothered me more than anything else was the fact that my front teeth, the thing that most people were able to see when you smile, weren't the way that I liked. And he took a look at it and told me, yeah, I can fix this and you'll be looking as good as new.
Dave came to see me earlier this year to see if I had a solution. He had lost a lot of bone in the front of his jaw at the time of his hockey injury, and the dental implants were placed in the wrong position.
When I first talked with Dr. Bahi about what was possible, he said, listen, we can make it look so you wouldn't even realize that you're wearing implants because of the way that we can build the bone back and get your gum back looking the way it should be and getting the color right and the size and everything. So I've been excited as we've gone through this.
I told Dave the only way to fix this was to remove the implants and to rebuild his jawbone and place new implants. I find in my practice more and more patients are coming to me with these issues after having paid a substantial amount of money to have their teeth replaced. My recommendation is simple. Make sure and then double check that the person who is doing the work is a qualified specialist with dental implant experience.
When you feel that it's not right, you're a little self-conscious, but then when you see what it looks like when things can get worked on, you just feel so much more at ease. So far, everything has been fantastic.
It was an amazing story, for him with the prescription he started at. As soon as I saw the consult and knew that we could do something, I was like, wow, this is going to change his life. This is going to be amazing.
Kevin Dull has been wearing some type of corrective lenses since he was 2 years old. He spent all of his adult life wearing hard contact lenses. To say they were restrictive would be an understatement, and sadly, he was convinced there wasn't much he could do about it.
My window of eyesight was very, very small. It would be maybe a 1/4 inch in front of my eye. That would be it. Since I was not a candidate for laser surgery, the corneal laser surgery, my refraction was too high to get corrective, that something like this was my only option that I could get to get out of my wearing corrective lenses.
After consulting with his optometrist, he was referred to one of the doctors at Iris. To Kevin's surprise, he was a candidate for refractive lens exchange surgery. This is a procedure where a patient's refraction is corrected by replacing the eye's clear, natural lens with an artificial intraocular lens.
And it was a process, there was time where he needed to be out of his contacts, but the contacts that we needed to put in for a short period of time didn't come in his whole prescription. So there was a time where he was in contacts with glasses over top, and then the Coke bottle glasses for a while afterwards as well. So he was very motivated to do this.
It's based on a cataract replacement. I went in 20 minutes, they go in there, take my old lens out, and put my new one in. The minute you come out of surgery, you see. Your eyes are dilated, but you do see.
Kevin's refraction was so big that he was not able to receive 20/20 vision initially, but the improvement is amazing, and now he has more options than ever.
So when you live life as a nearsighted person, if we flip the dial, it's totally, your world is kind of flipped upside down. So for him, everything is very clear up close prior to the surgery. And if you overcorrect him, then everything up close is completely blurred. And that just makes life very difficult for some people to adapt to. Our goal is to get his vision as close as natural. And then if he needs a little help to clear that vision with glasses, contacts, or even laser surgery after, that's what we want to do.
And now, so I have a choice now. I can wear nice glasses, I can wear soft contacts, I can even see if I'm appropriate for the typical cornea surgery to bump me up to 20/20.
For Kevin, the procedure has made a world of difference. In the end, he not only experienced an improvement in vision, but better sleep, less stress, and an improved quality of life.
It was huge. You know, I got this eye done first, my right eye, and the left eye done. 2 days later, I went for a walk downtown on the strip where I live, and I just remembered, I'm like everybody else, I'm walking around with no correction, you know? This feels great, you know, the wind in my eyeballs. I had no contact lenses. It was quite a feel. I'll never forget that. That was really great.
After the break.
Today's recipe is barbecued back pork ribs, and we're going to cook them for a period of time in the crock pot and then put them on the barbecue to finish them.
This cooking and nutrition portion brought to you by Save On Foods.
It's cooking time on Empowered Health, and I'm in the kitchen with registered holistic nutritionist Julia Olden. Julia, welcome to the show.
Thank you very much.
What's today's recipe?
Today's recipe is barbecued back pork ribs, and we're going to cook them for a period of time in the crock pot and then put them on the barbecue to finish them. The first thing we need to do is chop about half a cup of onions.
Okay.
And while you're doing that, I will start with the sauce.
Okay.
So we're putting a cup of tomato sauce here. And we've got some brown sugar.
Right.
It's about 1/4 cup of brown sugar. We've got some chili powder and a couple of cloves of garlic.
Right.
I use a little bit of chicken broth here, but you could use red wine or dry red wine or even water if you wanted to, just to make it a little bit less thick. So we stir that up.
Okay, and mix it all together nicely.
Mix it all together. We put about a teaspoon of Worcestershire sauce in here.
Okay.
And the liquid smoke just gives it the sort of barbecue-y flavor. Some people don't want to take the ribs and barbecue them. They just want to serve them out of the crock pot. So this just gives it a little bit of smoky flavor like you have barbecued it.
Right.
And then hot sauce. I like the hot. I'll put a little bit of salt. So with the crock pot, you're going to cook them for about 3 hours in the crock pot and then put them on the barbecue, but it will make them so that the meat will absolutely fall off the bone. It is amazing how tender the meat becomes after cooking in these crock pots. And for anybody who's really busy, crock pots are lifesavers. I think that's probably good. We'll just stick these in here. So we mix this all up. And then what I like to do with the ribs is actually cut them so that it's almost a serving size. So I usually take, 3 or 4 ribs and slice through that and then just place them in the crock pot here. And then we put them, we put the sauce over top. And you can see how meaty these are. There's lots of meat.
Yeah, good thickness.
Yeah. So we just place them in the old crock pot here.
Right.
And put our sauce over the top.
Put the sauce on there, okay.
Turn it on and walk away.
And this is going to stay there again for?
This is going to stay here for 3 hours on
3 hours?
On high.
So we can go watch a Bollywood movie then.
We could, yeah, totally.
All right. Julia, the ribs are out of the crock pot.
This
smells so good.
Yes, I'm hoping they're going to be excellent. Some people take them out of the crock pot and actually put them on the barbecue for a couple of minutes just to finish them off, but they're just as delicious coming straight out of the crock pot.
Right. And what did we do with the sauce?
So the sauce, we basically took the ribs out and put them on the platter, and then we took the sauce in the bottom of the crock pot and we put it in a pan and we boiled it down, I guess.
Just to
sauteed it down
yeah.
to thicken it. So I'm going to try and pour this into this
right here
cup that we have here.
Nice.
And we would just take this to the table and let people serve themselves and have some sauce at the same time.
Well, this is going to be really good, and thank you so much for being on the show and showing us this awesome recipe. Who doesn't love ribs that melt in their mouth? You just saw a recipe, and to talk more about it from a nutritional perspective, registered dietitian Crystal Higgins joins me. Crystal, welcome to the show.
Thank you.
Now, pork ribs are a summertime favorite, and there are many different types and flavors. Which one do you recommend?
I would recommend going for a natural, unflavored cut, and then that way you can control the amount and the type of sauce that's added to it. A lot of the pre-flavored varieties are coated in very heavily salted and sugary types of marinades, and it's very easy to actually concoct your own marinade to coat your ribs.
And what about the type of meat?
Well, when it comes to the type of meat, the less white marbling, the better.
Because that's all the fat, right?
Exactly. And keep in mind that bone-in cuts of meats will tend to have more fat and marbling, and that's because it's the least exercised portion of the animal compared to the loin, which, has a little bit less marbling to it. So keep in mind that our animal proteins should only make up about a quarter of our plate. The remainder should be vegetables, salads, and whole grains.
So as with everything else, quality is more important than quantity.
You bet.
Well, Crystal, thank you for being on this show, and we'll see you again.
My pleasure. Thank you.
Well, that's all for this episode of Empowered Health. I learned a lot. I'm certainly not going to think twice about having eggs in the morning.
Well, that's a good thing, Michelle. And for everyone who's watching us, be sure to keep in touch by following us on Twitter or liking us on Facebook. We'll see you next time.
Thanks for watching.